Hi, it's Katie Harris, and today we have Gabby Rathz. Oh my God, I'm not going to start over. It's Rathz, right? I said that correctly?
Yeah, it's right.
Okay.
It's right.
All right. Hi, it's Katie Harris, and today we have Gabby Rathz with us. She is a physical therapist who works at Invictus here in the city. So very excited to talk about pain and menopause because this is a big issue, Gabby, and I'm so glad you're talking about it. So take it away.
Thank you so much. So I'm Gabrielle Rathz. I'm a pelvic floor physical therapist at Invictus Physical Therapy. And I'll be discussing pain and menopause just because this is a really important subject. It impacts so many people. Like, according to the North American Menopause Institute, there's 1.1 billion people who are going to be in menopause worldwide by 2025. So, this is clearly a topic that touches a lot of people. And I think what's interesting is that AARP did a survey and they found that 84% of people who are going through menopause have menopause symptoms and have pain, but that interfered with their lives. And 42% of those went to talk to a clinician about it. And of those 42%, only 1 in 5 were recommended to a menopause specialist. So this is definitely a topic that doesn't get enough attention. And I think it's really important for us to shed light on it and learn about the different treatment options. So in order to promote overall health and well-being during this stage of life, we need to recognize and manage the changes that occur during menopause and perimenopause. So we need to understand what happens during these times. And I sort of want to talk about perimenopause and menopause because there's a lot of changes that we can make during perimenopause that will impact our aging process. So perimenopause is this time of transition. It's characterized by fluctuating hormones and estrogen excess. During this time, your periods will change. So they can be longer, they can be shorter, they can be heavier, lighter, more or less frequent. It's just a time where there's fluctuations in the flow and duration of your period. There's also going to be fluctuations in different things like your mood, your sleep. This is you can get hot flashes, weight gain, memory, and also it will impact your heart and bone physiology. So again, the reason I bring up perimenopause is that this is a really good time to make lifestyle changes to ease the transition into menopause. And it's something that we can sort of start thinking about in our early 30s or even before so that we know what to expect. One thing I think that is helpful is tracking cycles. So there's different apps that are available on smartphones. And one of them is called Flow. That's the one I use. And that way, when you're tracking the cycle, you can tell when the changes are occurring and what changes are taking place and recognize what's going on with our bodies so we can better transition into menopause. Now, most people will go into perimenopause about 10 years before menopause. And one thing that's important to note about perimenopause is that sometimes the symptoms can be worse in perimenopause than during menopause, and sometimes it's vice versa. So you don't really know what's gonna happen, and it's important to know that there can be changes from person to person so that you aren't surprised. Now, menopause is defined as the cessation of menstruation for 12 months consecutively. It's the natural biological process of a female's reproductive system shutting down and marking the end of menstrual cycles and fertility. The typical age for menopause is between the ages of 45 and 55, with 51 being the average in the US in 2019. And if you think about that, the average age of death is 83. And so we're spending an average of 32 years in menopause, meaning that we need to learn how to manage it. This is where this comes into play. This is, another really great opportunity for us to make life choices to aid in aging. So the common symptoms of menopause are caused by a decline in the production of female hormones of estrogen and progesterone. And this leads to the changes in ovulation and menstruation. So the symptoms include night sweats, there's sleep disturbances, dry vagina, eye skin, hot flashes, temperature swings, having like a racing mind at night, which I have anyway, but it's worse than menopause. Pain during intercourse, back or joint pain, headaches or migraines, and mental fogginess. And then there's also a number of health risks that are associated with menopause, one of which is diabetes, there's heart disease, having more UTIs, dementia, dyspareunia, which is pain with sex, and then osteoporosis. And it's good to know all these health risks because there are treatment options available to address them, one of which would be physical therapy. So intro to menopause pain. During menopause, the ovaries stop producing estrogen and progesterone, like we just said, and that leads to hormonal imbalances that can cause various symptoms, including pain. So estrogen is responsible for a lot of things. One of these things is bone growth. And so when we have this decline in estrogen, this can lead to the bone architecture being changed and the bone density being lost, and that can lead to a decrease in overall strength. And now there's like a decrease in bone strength, and there's also a decrease in muscle mass because of the decrease in estrogen and androgens. So this could be the primary cause of age-related muscle loss and strength, and having this muscle loss and strength deficits and bone loss can lead to pain. And musculoskeletal pain is actually very common in menopause. Specifically, like muscle soreness and aches are common during menopause, and this is because we have the decreased muscle tone from having less estrogen. We have reduced flexibility. We have increased muscle tension, and this is all because of the hormone changes. And all of these things sort of come together to act on your system, which is your body, and cause imbalances, which lead to pain. And there's also this thing, it's called the genitourinary syndrome of menopause. And this sort of encompasses a range of symptoms that are related to the vaginal and urinary tracts. There's decreased estrogen again. And so what happens is that the vaginal walls can become thinner, they can become drier, they're less elastic, and this can lead to painful intercourse and other discomfort in the pelvic floor / pelvic region. And this can also lead to urinary frequency and incontinence. And what happens is that there is more vaginal dryness too, and irritation that can occur because of having less estrogen. And this can lead to discomfort and pain during menopause and urinary problems. So this is also something that can be treated. The last thing is that having like the hormone fluctuation and estrogen decrease during menopause can lead to headaches and migraines, and this can cause significant pain and discomfort. So there's a number of management strategies. The effective management strategies of chronic pain during menopause may involve hormone replacement therapy, pain medication, physical therapy, and lifestyle modification. So some of these I think are better discussed with your primary care dietitian or like other healthcare providers, but I'm going to be discussing the physical therapy and lifestyle modification part of it. The role of physical therapy. So physical therapy can play a really important role in the management of pain and discomfort associated with menopause. By addressing the musculoskeletal issues, pelvic floor dysfunction, and other menopausal symptoms, physical therapists can help people find relief and improve their quality of life during this period. So the first thing is cardiovascular exercise, which we all know helps increase endorphins and makes us happier, but it also can help with pain. So like regular cardiovascular exercise, like brisk walking, swimming, cycling, doing the elliptical, anything that's like raising your heart rate, all of these can improve blood circulation and reduce inflammation and also boost the endorphins. And this can help decrease menopause-related pain. And I think it's like, it can be a catch-22 almost, where like you're already in pain, so you don't want to do cardiovascular exercise. And so you're like, what do I do? I don't want to do cardiovascular exercise to get out of pain. So what do I do? And this is where seeing a PT can be really helpful, because the PT can examine you and like figure out the exact mechanism and cause of the pain and get you like a better pain place so that you can start doing cardiovascular exercise and in turn get better blood circulation, inflammation, reduction, and better pain. There's also strength training. Strength training is incorporating strength building exercises that target the major muscle groups, and this can help strengthen the body, improve posture, support joint function, and this can significantly reduce menopausal related aches and pains. So one thing that's important to know is that bone is deposited in proportion to the compression load that it has to carry. So what that means is that if there's less load being put on your body, less bone is going to be deposited. And so then if there's more bone is going to be deposited. And we already know that estrogen decreases lead to loss in bone density. And so doing what we can to increase the load on the bones so that they can deposit more bone is really beneficial. So what they found is that resistance training needs to be done 2 times a week to see benefits, specifically at 2 sets of 8 to 10, 2 sets of 8 to 10 for each exercise at 80 to 85% of your 1 rep max, and has to include every major muscle group. It should be individualized based on your tolerance and current activity level. So you don't want to go from not doing any strength training to, doing squats with 50 pounds. We might want to start with just sitting to standing, and then sitting to standing holding weights, and then maybe then we get to squatting. So it really should be individualized to where you are. According to studies, the best way to gain strength is to do a combination of high intensity weight bearing and progressive resistance training. This is like the most beneficial for improving bone density too. And they found that resistance training changes the muscle both in young people, which we know, but also in older participants. So what we know is that resistance training, weight bearing activities, and balance are all super important for maintaining bone and muscle health as we age. Stretching. So it's important, stretching is important. It maintains flexibility, especially as we age. Now, we get weaker back muscles because of the changes that happen in the musculoskeletal system. And this can be associated with progressive spine curvature. That's where we start to see that curving in the back of the spine, back of the neck. A lot of people, because of this, lose shoulder and thoracic mobility or trunk mobility. And another thing that's important is that the most common place for compression fracture is in like the trunk, the thoracic area of the spine. And so increasing flexibility in that area can be helpful. Specifically, stretching exercise help improve mobility, they reduce muscle tightness, and they alleviate pain in a lot of the different body parts that are affected by menopause. And there's a few good stretches that you could do. One would be a sideline thoracic rotation. So let me see. Tell me if you're able to see me. I'm going to move this over so I can show this on the floor.
Yeah, absolutely.
Okay, perfect.
Love the interactive.
Yeah, it's interactive. So this is a great stretch. You would get on your side. You can use your bolster if you have to. And then put the top leg at this like 90-degree angle. It's more comfortable if you use this, but you can also do it on the floor. You can do it on a pillow. Arms are going to go in front of you, and then sort of just going up, following your arms with your head, and then coming back. And that's going to help really increase the rotation and flexibility of these muscles. Then there's also the angel stretch lying down. So laying on the ground. Arms are going to go to the side. Can you see that maybe? We're going to go up and down. So it's sort of, I'll show you the equivalent on the wall, and this is what you would be doing on the ground. So you're here and just bringing your arms up and down. And like if you do it, you'll feel a pretty solid stretch. And it's good for activating these muscles and just relaxing or bringing down tension. For a dog, it is great for core. It is also really good for range of motion. I have enough room for this, but we're going to try. So one leg goes out and then the opposite arm goes out. Usually your leg would be straight and then you would do the opposite. So Here, trying to keep your back as flat as possible, and then repeating. Great for core, also just great for movement. And then the thread and needle is on all fours here, bringing one arm down under and just holding. I would do these. First of all, I think it's good for a lot of people to just stretch every day, get more blood circulation, get more flow. But like 10 seconds, 10 times a day to start, and then increase as tolerated. Or you can even like start with lower sets, but getting some sort of stretching in. The other thing is that with yoga, like yoga can be a good form of stretching. There was this one study and it had like over 700 participants over a 10-year period. And they did this 12-minute video with 12 poses. And what they found is that, well, first of all, like 83% of them had osteopenia or osteoporosis. And then at the end, after the 10 years, there was a small but significant change in bone mineral density in the femur and the spine. So going through those yoga poses, it doesn't have to be a super long yoga class. It can be a 12-minute class with 12 poses. And that has been found to have benefits. Pelvic floor physical therapy, my favorite. So pelvic floor PT plays a really crucial role in managing the symptoms of menopause, including pain and incontinence. What pelvic floor PT does is it addresses the muscle tone in the pelvic floor and in other regions, along with muscle function and coordination. And by addressing all of these things, it's like it uses a number of techniques to optimize pelvic floor health and alleviate symptoms. So we're sort of looking at the actual pelvic floor and seeing exactly what's going on with the muscles. So let's say like there's vaginal dryness with pelvic floor physical therapy, or we would actually look at the pelvic floor and we can give recommendations on different moisturizers. Maybe the dryness is leading to some tightness, so you can go in and help loosen up the tissue. So it's going to improve the pelvic muscle strength, decrease pelvic muscle tension, enhance bladder and bowel control. I feel like as we age, we're just told that we're all going to be incontinent, and that's that, and just get used to it. And like, that's just not the case at all. It's something that's very common, but it's not normal. And in pelvic floor physical therapy, you can take a look at the muscles themselves and see, are they really tight? Is that what's leading to have incontinence? Are they weak? I think we're told again that like just doing Kegels, you're incontinent, do Kegels. But that's not always the best option. So it's good to actually get your pelvic floor muscles looked at to see exactly what would be beneficial for you. It's also really great for the, like we were talking about, the genitourinary syndrome of menopause. There's like these changes in the vulva and the bladder due to less estrogen, and that leads to the vaginal dryness, the pain with sex, bleeding and discomfort, urinary frequency, incontinence, pain with urination. And this can actually be a progressive thing unless you get effective treatment, because as we age, the tissue will continue to break down and become more frail. So we want to sort of nip it in the bud and address it right away. So like with GSM, with the genital urinary syndrome of menopause, we would look at your specific symptoms, see what does your skin look like? Does it look like it's irritated? Do we need to recommend moisturizers? Are the muscles weaker? If so, can we strengthen them? We want to make sure that we're strengthening them in a way where they're contracting correctly. There's this study that showed that there's a correlation with incontinence, and incontinence is correlated not only with decreased strength and endurance, but tone, reaction, control, and coordination. And pelvic floor PT can help regain these. Also, the other great thing about pelvic floor PT is that if you're having pain with sex, you can not only address the tissues, but there's sex education, including positions and supports that can make things more enjoyable. Lifestyle changes. So lifestyle changes, I would recommend seeing specific specialists for each one of these, but I'm just going to give a general overview. For diet and nutrition, adopting a balanced diet with increased intake of fruits, vegetables, and whole grains to improve overall health and well-being is important. I see nutritionists. I feel like knowing exactly what nutrients to put into your body can be really helpful, especially as we age, especially as there's hormone fluctuations and as we see changes in our bone health. So finding a nutritionist has been amazing. Also, exercise routine. We already sort of talked about like cardiovascular exercise and how that increases endorphins and leads to having less pain. Specifically, like the American Heart Association says that you should exercise, do 150 minutes a week of moderate intensity activity or 75 of vigorous aerobic activity, and like spacing that out throughout the week. That can also help you maintain a healthy body weight and help decrease pain. Stress management. So I am the biggest fan of stress management, and like just therapists as we get older, I would highly recommend every person get a therapist. There's also stress management techniques that you can do without a therapist. One is like you can do meditation, you can do yoga, you can engage in the things that make you happy, do more of your hobbies. One thing that I do this every morning for stress management, is alternate nostril breathing. So what you do is you take a deep breath in, you cover both nostrils, you're going to release one, breathe out, and then breathe in with that same one, cover, alternate, breathe out, breathe in, cover, alternate. And I'll just do this like 10 times on each side. And it's a great way to just get the nervous system to relax, get everything to be in the more relaxed state. Because when we're stressed, our muscles tense up. When we're stressed, like we're more likely to be in more pain. And so just doing things to help alleviate stress can be really helpful. And then sleep habits. Sleep is really important, which I'm learning as a new mom now. They found that a cycle less than 7 hours is associated with a number of health risks, including higher rate of cardiovascular disease, increase in blood pressure, increased risk of stroke, higher rate of obesity and type 2 diabetes, and increased risk of certain types of cancers like breast and colorectal. And perimenopause and menopause are already associated with problems falling asleep and staying asleep and with nighttime awakening. And so having good sleep hygiene is especially important during this time. And just a few recommendations: winding down at least 30 minutes before you go to sleep and then unplugging all your devices, and get some light exposure during the day. When we get light exposure, that helps with the circadian rhythm. And then keeping lights low in the evening. Keeping your caffeine intake to earlier in the day. And the suggestion is to keep caffeine intake up to 400 milligrams and trying not to drink caffeine, 6 hours before bedtime. And then avoiding alcohol and dinner right before bedtime. And remembering that your bed is for sex and for sleep. And that way, when you start to go into bed, like you're just associating it with those two things, and it makes it easier to fall and stay asleep. And know when to seek help, know when to seek treatment. So if you're in pain and you're trying cardiovascular exercise and you're trying stretches and you're trying moisturizers and you're on hormone replacement therapy and you're still having pain, that might be a good time to see a specialist, whether it's a pelvic floor specialist or an orthopedic physical therapist. Reach out and get the help that you need. These are all things that can be treated and that we don't have to live with. I'm going to close this out.
Awesome, Gabby. That was really awesome. And that statistic, 84% of women going through menopause or having pain, and 42% seeing somebody, and only 1 in 5 actually getting a referral. That's insane.
It's crazy. It's really crazy. There's not enough attention being brought to this population.
Right.
And so everyone's going to go through it. So every person with a vagina is going to go through it. So
It's true.
we should learn what's out there.
Right. And you made a point too, that even when they go, like, I don't know that clinicians know what to say. And one of my patients said it, she's like, my OBGYN doesn't seem to be interested in me anymore because I can't reproduce. So you get like 7 minutes of time and they don't have anything to offer.
I think that's problematic. And there's also like been surveys of people in medical school and people outside of medical school asking how comfortable they are treating menopause. And I think there's not as much comfort and knowledge around it. So just raising awareness of menopause and treatments and knowing that every person at whatever phase of life should be comfortable and happy and be treated well.
Yeah. And, there's another statistic out there that says adults buy more diapers for themselves than they do for kids at this point. And there's this idea that urinary leakage and urinary incontinence is just something that happens to you when you get old.
There definitely is. It's like, you're getting older, you're going to leak, just get a diaper. And it's just not, it doesn't have to be the case.
Right.
There's so many options out there.
Right. Yeah, absolutely. I love those stretches. I want to do them right now. Like, that looks so nice.
They're so comfortable. I do at least one of them every single day.
Really?
I do.
Yeah.
It's really helpful.
Yeah. And how about for like joint pain?
Like stretching for joint pain?
Or any, you have physical therapy for joint pain, right?
Yes. So like, it depends on the joint. It depends on what's going on. You would sort of want to figure out what's causing the pain. It's sometimes like we have joint pain because the muscles are really tight. Sometimes we have joint pain because the muscles are weak. Sometimes we're just not moving them enough. Like if I like clench my fist and I hold it, and I'm not moving it, like that's going to hurt. So we got to figure out what's going on first. So like if your muscles are really tight, doing a nice stretch. So like if you have wrist pain, just stretching it out here. Same with like shoulder. You can go over anything that like helps you feel a stretch in a way that's not painful. And doing it like for like 10 seconds at a time. So stretching, and then also doing progressive resistance training. So strengthening if weakness is something that's going on with you. And honestly, strengthening is just a good idea to do anyway, because we do lose muscle mass as we age. And again, that doesn't have to be the case. So gradually increasing strength training helps to build the muscles and the bones around the joints, which helps with pain.
Yeah. And strength training comes up so often, whether you're talking about like doing weight loss or menopause or, old age or, whatever the case may be. It always seems to come back to muscle strength and stability as like core factors of how you age.
It's so true.
Yeah. Okay. And then, so for joint pain as well, because I do get a lot of women when they come in and they've hit 50, they're, in menopause or just about to go into menopause, and they do complain of like kind of a generalized joint pain. I mean, is that something you guys see a lot?
Oh my God, all the time. And it's that, the changes in hormone levels, from one, like having less estrogen leads to having, again, like bone mineral density loss and muscle strength issues, which then impacts the joints. But I think the other part of it is that like people are, because they have less strength, they're in more pain, they don't exercise as much to try to avoid pain. At least a lot of the people that I see, because they're scared of being in more pain by exercising. And then so they're more sedentary, and then when we're more sedentary, there's less blood flow to different joints. And when there's less blood flow, there's less oxygen and nutrients. And so then that leads to like a general achiness. And I found that just encouraging movement, motion is lotion, movement of any kind, like shoulders hurt, move them around, obviously you don't want to do it in a way that makes the pain worse, but just moving things around, moving your body, going on like even a short walk, 10 minutes, can really help with the joint achiness. And then the other thing is that breathing exercise, it sounds silly, but it really helps to calm down the nervous system. And when the nervous system calms down, the muscles can relax a little bit more, and now they're pulling less. And so then that can lead to less achiness and pain. So there's all these really great techniques for it.
Yeah. Tell us a little bit about how does somebody know when PT would be like the right thing to do?
That's a great question. I think if you're having pain and you've tried moving and you've tried stretching and you've tried like massage, and it's not working for like a period of a week or two, it's just a good idea to get checked out. Honestly, I'm of the belief that everyone could benefit from physical therapy. It's one of those things where, like, we get annual exams every year just to make sure that we are healthy and that, like, to prevent anything from happening. I think that the same would go for physical therapy, ideally. If you're having pain at all, or even if you're not having pain and you're like, I'm getting older and I want to make sure that my muscles don't become weaker and I want to know that I'm doing the right exercises. Like, I think that's a good time to see a PT. Certainly, like, if you're having any pelvic pain, any pain with sex, any like incontinence of any kind, see a PT right away. Just, get it looked at. You don't know what exactly is going on with the muscles. And I can't tell you how many times people come in like with incontinence. And they're like, I've been doing Kegels nonstop and I still have incontinence. And it turns out that their muscles were really tight. And that was like putting more pressure on the bladder. And that's what was causing the incontinence. And so tightening it even more with the Kegels was making it worse. And so there's just like no, I guess, one size fits all. And so going in and even seeing someone for one session or for a 15-minute talk, and they can let you know, like, hey, PT is appropriate for you. It's not appropriate for you. Like, a lot of offices at Invictus, like, you can call and ask to talk to one of the PTs. And I know a lot of PT offices do this. Like, just ask to talk to one of the PTs, tell them what you're feeling. And then, we can tell you, hey, like, I would just go see a personal trainer, go to see a massage therapist, or just do movements, or like, I think that you should come in,
Yeah. So do people need a referral to go to PT?
It depends. In Pennsylvania, you can see a direct access PT. So you have to get your direct access license. You can see them without a referral for 30 days, and then you need a referral after that. If like with certain insurances, they will require a referral. In general, like if you're going outside of insurance, though, it's that 30-day period, and then you do need a referral from a healthcare clinician.
Okay. Do they typically get problems or have problems getting referrals from physicians once they've decided that's what they want?
I've never had a problem.
Oh, okay.
I feel like physicians have been really, really encouraging of PT. They want to help people get moving, help people get out of pain. I think the only time I've seen any difficulty is if the person hasn't seen their doctor for over a year. But in that case, the doctor just wants to see them to make sure that everything's okay and to check in and to do that annual exam. But other than that, there has not been a problem.
Okay. And insurance pays for PT?
Insurance pays for PT.
Okay. Again, but you can also pay out of pocket.
You can also pay out of pocket. So insurance, depending on the insurance company, they'll give you different amounts of visits for physical therapy. So you might get 20 visits, you might get 10 visits, and then you would work with your PT within that visit allocation to get a treatment plan that works best for you. Like here, and I think with most PTs, they'll try to get you in as little as possible so that you're not spending as much money and as much time. But if you go above that allocated amount, then you do have to do out of pocket, or there can be appeal processes.
Okay. And what about like, I know frozen shoulder gets to be an issue in menopause. Is that something you guys deal with as well?
It is, yeah. So frozen shoulder is, there's depending on where you are in the process of the progression of frozen shoulder, there's either a lot that you can do or there's less exercises that you can do. Either way, there's a lot that you can do for pain management. And so we see people in all different phases of frozen shoulder and are able to help them at least manage the pain.
Okay. Why does that happen is it specific to menopause? I mean, I know everybody gets frozen shoulder, but it seems like it happens a lot in menopause.
It does happen a lot in menopause. That's a really good question. I don't know that I know the answer to that. I think that it is likely more common in menopause because of the hormonal fluctuations and because of the changes that are happening in the bones and in the joints and because of the inflammation, because frozen shoulder can be very inflammatory, like it's an inflammatory diagnosis. So I would imagine that menopause would exacerbate those things, which would make it more likely. With that being said, I don't know that that's 100% why.
Okay. I mean, it makes sense. Absolutely. Like menopause is also known as inflammapause. And yeah.
I've never known it like
it. But is there any like urgency with frozen shoulder? If you start to get it, should you see somebody sooner rather than later? Or
I think with frozen shoulder, there's less of an urgency. Frozen shoulder sort of is going to take its course no matter what. So there's different phases of frozen shoulder. There's like the freezing stage, the frozen stage, the thawing stage. And depending on where you are, the tissue just sort of has to do its own thing. So it's not urgent. I do think that it's helpful to come in sooner rather than later, because even if you can't, like let's say you're in, the frozen stage where the shoulder's just not going to be moving, like you might not be able to get a ton of movement, but you can help with pain and you can learn other strategies to use that shoulder, use your body to get the things done that you want to be done.
Okay. So when they have frozen shoulder, are they just not able to lift it up? Or what kind of limitations do they have?
So it's lifting, it's rotating, mainly lifting and rotating. There's just like the motion is just not there. And you start to lose motion and then it sort of stays in that tight state.
Okay. So they might, wake up one morning and feel like they slept on their arm wrong or something, and it just kind of develops from there.
And then it just sort of develops from there. And I don't think they know exactly why frozen shoulder occurs. But once it's come on, it takes its course and you can do what you can to help alleviate it as much as possible.
Okay. Awesome. So what about Invictus? Can you tell us about what you guys do there?
So Invictus Physical Therapy, we are an outpatient, like mom and pop shop. So I started this clinic with my best friend from PT school, and it was sort of like named after my brother, Yoni. His favorite poem was Invictus, and he wanted to serve the medically underserved population in Boston. So when he passed away from cancer, we were like, let's open up something in his name and in his honor. We named it Invictus. And our big goal is to provide like individualized, as much one-on-one treatment as possible. And we treat all orthopedic conditions, we treat balance impairments, we treat pain. I'm a pelvic floor physical therapist, so we do pelvic floor PT. There's also all the PTs here are running specialists and running coaches, and they have certifications in vestibular therapy. So I think for us, we really wanted to get as much experience as possible and as many certifications as we could so that we could serve all of Philadelphia in the best way possible.
I love it. So if people want to find out more, where do they go and how do they find you?
So you can either call 267-548-4476. That's our office number. We also have a website, www.invictuspt.com. And there's a form there that you can fill it out. You'll come straight to us. We'll call you to make an appointment. Or if you have any questions, just give the office a call and anyone will be happy to chat with you.
Awesome. Well, thank you so much for sharing this with us.
Thank you so much for having me. I'm so excited that you're doing this. I think this is really important stuff, and hopefully it'll help a lot of people.
Yeah, absolutely.
Thank you.